My name is Dr. Sandra, and today I'm going to share with you my Invisalign teen journey. I graduated from the University of Minnesota in the United States, where I received my orthodontic training. I've been Invisalign certified since the year 2000, and I'm a Diamond Plus provider who has completed over 2,500 lifetime cases. I'm a clinical assistant professor at the University of British Columbia, as well as an adjunct clinical assistant professor at the University of the Pacific in San Francisco. I'm a diplomat of the American Board of Orthodontics. I speak widely at conferences all over the world. Primarily, I'm in private practice in Vancouver, Canada. I'm on the editorial board of the Journal of Aligner Orthodontics, as well as a reviewer for the American Journal of Orthodontics and Dentofacial Orthopedics. I'm the author of Clear Aligner Technique, a textbook that's published by Quintessence Publishing. When all of us started using the Invisalign system, we started with adult treatment who primarily asked for a more aesthetic and invisible orthodontic appliance. Eventually, as the demand for aesthetic treatments grew, many of us started treating younger and younger patients with the Invisalign system. So how did I begin treating teens with the Invisalign system? Let me tell you Samuel's story, the story of a little boy who came to my practice. When Samuel first came to see me, he was only 10 and a half years old. He had already transitioned into the full permanent dentition, but I thought he was a little young for treatment. So I told Samuel, I think you're a little young for treatment. Come back in 6 months and then we'll start. So when he came back, he was 11 years and 3 months old. And now we were ready to start. We collected our pre-treatment records, and this is the malocclusion that Samuel presented with. You can see on both right and left buccal segments, he is a class 1 buccal occlusion. The upper incisors are severely proclined, leading to an increase in overjet. There's minor crowding in both upper and lower dental arches. When we consider his facial profile, you can see that the lower lip is slightly retrusive, but he has a fairly good chin projection. These are Samuel's pre-treatment radiographs. On the panoramic radiograph, you can see that all the permanent teeth are present, including third molars, as well as on the cephalometric radiograph, you can see the upper incisors are proclined and protrusive. Now take a look at these records again, and I want you to think, how would you treat this case? Would you extract? Would you not extract? What type of orthodontic appliance are you going to use to treat the case? Will you use fixed appliance? Functional appliance? Would you use metal braces? Would you use Invisalign? Well, here's what I recommended: a non-extraction with full fixed braces and low torque brackets for the upper incisors. How do you think the patient responded? Do you think he was very excited and happy that he's going to get his fixed braces? After all, he was only 11 years old. And many of us doctors think that children that age are very excited to go into metal braces. However, this was not the case with Samuel. He was not happy that I suggested metal fixed braces to treat his malocclusion. Here's what Samuel said to me. Dr. Tai, is there any reason why I can't have Invisalign? Wow. What an interesting comment from a very young patient. And I said to Samuel, where did you hear about Invisalign? And he said to me, well, Dr. Tai, I saw some brochures in your living room, in the waiting room, and I would like to know, is there any reason why I can't have Invisalign? And so, why didn't I think of recommending Invisalign